Hi, my name is Deshana Yamini, and I have had the opportunity to meet some wonderful people over the years who love what they do. And I thought it would be a wonderful idea to introduce them to some of you to help you make a decision if you're trying to find out what it is you want to be in life. So we are looking for a number of people to show us what they do. Today we are here with my great friend, Verdun, who is a dental hygienist at Brilliant Smiles in Xenia, Ohio. We're going to be talking to him about what he does. And if you don't have an interest in dental hygiene, maybe you'll be inspired by something he says. Thank you so much for having me.
Well, thanks for having me. I'm having a ball.
So what inspired you to become a dental hygienist?
Well, honestly, my dentist as a kid was just really, really nice. I knew I needed to have a career that I could pay my bills and whatnot. And cleaning teeth seemed like it would be easy. It's not, but it's a whole lot of fun. It's a whole lot of fun. I've always liked the instruments and the tools that they have. You call them instruments, not tools. But, I thought all the gadgets were cool. So that's what got me.
And so about how old were you when you made that decision?
15.
Okay.
Yeah, 15.
Okay. So you never thought about another career?
Not really. I thought about being a dentist, but that's it.
We're going to come back to that question at the end. So you attended community college. What was that experience like?
It was a ball. I know people don't like community college, but I had a ball. I thoroughly enjoyed myself, and I was able to pay off my student loans like within 4 months of me being done with hygiene.
Wow. So you didn't have a lot of student debt?
Oh, no, I'm living life out here. It's nice.
Excellent. Were there any classes during your experience that you found difficult, if any?
Okay, so they're all very challenging. You have to actually focus to, graduate. Like, you're not going to be going out and doing a whole bunch of stuff. No, you're going to be in your textbooks and going over the PowerPoints, and you have to be very diligent. You don't really have any days off. So it's 2 years of, really hard work. Histology was probably the hardest for me, but it's just because you only went to that class once a week, and then it was just way harder than you thought it was.
And what did that deal with? What is histology?
Oh, like tissues and looking through the microscope to see, what a melloblast looks like, and, odontoblast and all that good stuff.
What type of math did you have to take? Any?
Oh, man, it was easy. The math, what was that called? Allied health math. It was easy and fun. The math was fine.
During your practice, while you were in college, you got to actually work in an environment where you practiced on people, cleaning their teeth.
Yeah.
Talk about that experience.
Oh my goodness. I'm a big worrier. I worry about a lot of stuff. So the first time I saw a patient, I was just freaking out, and I forgot my teacher's name, but God bless this lady. She was like, "Vern, just calm down." And, the more you do something, the more confidence you get. It was easy. But I don't even think I answered the question. I completely forgot. It was a fun time. I don't know. Clinic was a ball. I love clinic.
Yeah.
It was scary because you could make a mistake and lose points, but every day was a learning experience. You were always learning so much and getting so much better. It felt like you were, mastering a craft.
Right.
That, I don't know, every day you would go home tired and beat up from what happened during the day, but you won the battle.
Yeah.
So I don't know.
So you were under supervision in that environment, of course.
Yeah.
So was there a time where you were under less supervision because you were getting better and better, or were you always supervised?
Well, you were always supervised, but as they see how excellent you are, they give you a little bit more leeway. That was fun. I remember I had this one teacher. She was like, "Clean the whole mouth today," and normally you have multiple days to clean a mouth. Okay. And I was, terrified, but God bless her because, she gave me the confidence to be excellent. So
Wonderful. So were your patients in that environment, were they understanding that, hey, we are in a practicum environment?
Yeah.
Excellent.
No bad experiences with patients. They
Great.
were all excellent.
Because you were likely providing that service to them for a very reduced cost.
Oh, yeah. So if you go to Sinclair, you can get your teeth cleaned for like $10. You're paying with your time, though.
Yeah.
Because you're going to be there.
You're going to be there for a while. So once you completed your courses, was there an exam that you had to pass at the state level?
Oh, my goodness.
And talk about that.
You have your clinical ones where you actually have to, like, you have like a model of a mouse and you have to clean it, and then the judges come in there and they check to make sure you got all the calculus off, or if you detected it. That was terrifying, but we all passed.
So you actually working on someone during the test?
So no.
Okay.
They used to do that, but because it was COVID, we had to do models instead, and I think they left it with that. I shouldn't have like looked up the names of these tests, but that was 2 years ago. I know the clinical skills.
Yeah.
But the clinical stuff was scary, but only because it wasn't a real mouth.
Mm-hmm.
So it was a little bit different. But I wouldn't be concerned about that. It was very expensive. I remember it was like, I think it was all like $3,000, all those tests. So let me tell you, that was no joke. So save your money, okay? Save your money before you go in the program. You'll pay it off later. It's fine. But the actual written tests, those were scary at first, but like when you got in there, it was so easy. The state tests, so easy. The tests that we were doing in school were so much harder. They teach us so much that when I got into the test room, I'm like, this is all so easy. I went to this. I didn't mean to get this excited. Okay. We went to, what is it, like a review to make sure you pass the test. I'm reading the textbook and all that. And like, man, it was just common sense. Whatever was good for the patient was the right answer. You know? I don't know, but it was good. It was super easy. If you go to Sinclair, you'll pass. They really make sure that you're excellent.
So when you took your boards, how soon after you graduated and completed all that were you employed? Or did you secure a job before graduation?
I'm giving people advice. I think you should wait until you get your boards and everything. Go sub in a bunch of offices, see if you like it, and then make sure that, how do I say this? Make sure that you go to the right office for you. Don't be thirsty for a job. You will get a job. Especially, like, you have the skills, okay? If you care about your patients, you're there, okay? So people will love you. Don't worry about it. Once I got my license sent in, I called someone and I was working 2 hours after I got my license. You'll get a job.
Wow. So would you say demand for hygienists are high?
Demand now because a lot of people are
retiring. Yeah. Good point. Good to know. So what does a normal workday look like for you?
I come in, I quickly look over all my routes that I looked over the night before, like you see what the patient needs or whatever. And then you restock your trays, you get your patient, you bring them in here, you ask them what's going on with them, you review their medical history, get their blood pressure, ask them how much they're brushing and flossing, and what instruments they're using, and then you pretty much just clean them up, and then you wait for the doctor, you tell them whatever you saw.
And how many patients do you see in a day?
I see 8.
Okay.
Yeah. My job's fun. I don't know. I have a really good job.
I'm very
enough details.
No, that's perfect. So what would you say is the best part of your job?
Oh my goodness. My patients, I love them so much. They probably don't know. But there are so many things about my job that I absolutely love. I had this lady today, her son was graduating. I got to experience that with her, and we talked about like what it's like to raise children. I don't have no kids, but like, what it's like when they're leaving the house, and I was like, I don't know how you're not crying. Like, it's just you bond with your patients and you learn so much. You get to see people with grandchildren. Those are the happiest people in the world. I don't know why. They just love their grandbabies. And then you get those people that, it seems like they don't care about their oral hygiene. And then you show them how to floss and you tell them about, periodontal disease and all that. And then the next time they come in here, they look like the perfect teeth out of a textbook. You know what I mean?
So they're following your advice.
Oh, you're
right.
just ecstatic, but you don't want to be a weirdo that cares about teeth too much. So you just try to be a little normal. It's not possible. You know, we scrape teeth for a living. We're not normal people. But, yeah, I don't know. Like, the patients are definitely the best part of your job.
So if you're on a people person, don't become a dental hygienist.
Yeah, probably not. I mean,
Right.
you could, but it just makes, it's like ice cream on cake for me, you know?
Yeah.
It's because I like people.
Yeah.
Yeah.
What, if anything, do you dislike about your job?
If there's any gaps in my schedule, like, that makes me sad. When you get the patient in your chair and you're talking to them and you're cleaning, scraping the tartar off the teeth and everything, you're in your little flow state. But then when there's a big hole in your schedule or whatever, you're just kind of like, you know, making goodie bags or, you know, catching up on your notes. And that's not the fun stuff, you know. The fun stuff is like, you know, changing people's dental hair and whatnot, you know. I don't know.
So you like to stay busy.
Yeah.
Yeah. What advice would you give to a young person or someone who's looking for a career change who chooses dental hygiene? You already gave a lot of great advice so far, but is there any advice you would give someone who's trying to make a decision right now and has thought about this as a career?
Don't listen to nobody. If they tell you not to do it, don't listen to them. Okay? Don't listen to them people. Okay? If you want to do it, go do it. And then when you get into the program, spend all of your time getting better. Spend all of it. Don't take for granted. Don't leave early because you can. Like, learn as much as you can so you can be excellent when you get out in the real world because it'll pay later. If you can, save all your money that you need to live during the program so you don't work, so you can just focus on being excellent. You'll get the money back. Take some loans out. I hate loans, okay? That's not me, okay? But you'll be okay to take out loans and pay them off. Like, there's places that will, you know, make it worth your while to work there. So don't worry about money. Worry about becoming excellent. And then when you're working, always put the patient first. Go into every new situation like they're a brand new person. Have a backbone. Have a backbone. Do what's excellent. Don't worry about if they're going to like you at your job because they're most likely going to. Don't let them lowball you when it comes to your pay because, like, you might be new. You might actually do a good job. You know what I mean? You got the newest information. So, don't think because you don't have experience, you're not a good hygienist. I can't speak for every school, but Sinclair trains you so well, you're excellent, okay? If, you know, Mr. Clay was with you and Miss Hobbs and the rest of them, you're fine. You're fine. You're excellent, okay? So, and that's pretty much it. I could probably go on and on and on. Be nice to people. Oh, this is one thing, okay? This is the mistake do not be humble when you could get out, though, okay? Don't assume because things are a little bit different from the school routine that they're not doing it right. You know, you learn that there's some nuance, okay? I know you worry, like there's certain little things that they teach you to worry about, and you should also worry about those things, but, you know, there are some nuances. Work with your dentist and figure out what values they hold, and then work with someone that holds the same values as me. Like my dentist, you know, he's just excellent out here, so that's why I work here.
I know it's kind of rude to ask somebody financially how much they make. I'm not going to ask you that. But just with a smile, tell us how happy you are right now financially.
I am living life, okay? Let me tell you something. I've gained 30 pounds, all right? My dog eats steak, you know? That's ridiculous. I don't know why my dog eats steak, okay? My dog shouldn't be eating steak. My dog eats steak. There's a picture of my dog. She's fat. I go to all the concerts I want to go to. Like, I don't know what things cost, you know? So I know what they cost now because I'm budgeting, but, like, you know, I don't have to know what things cost. I'll tell you that.
Okay.
Oh, it's great. Oh, it's a ball.
Wonderful.
You know what I'm saying? Like, you know when people laugh because they're making money? Then I'm laughing. Okay?
Yeah.
That's a nice life. Okay? My couches are very soft. It was worth all the pain, okay? All the pain, it was worth it. I talk to cool people. My job's not actually hard. I don't have to lie ever. I'm just being kind to people. People that are nervous, you just make them calm, talk to them. It's so rewarding, and then you also get paid. I didn't mean to do this, but this thing says, I don't work, I have fun, y'all work weekends, because I don't work on the weekend. And if I do work on the weekend, they pay you crazy to work on the weekend in some random office, okay?
Yeah.
And you meet cool people that way. Like, I'm telling you right now, best career. Best career. I don't know what people are doing there.
What's next for you?
I don't know yet. I keep on going back and forth on whether or not I want to go to dental school. But dental school would be cool. But I want to save up a lot of money before I would try to do that.
So you just loved it.
Yeah, the whole
I'm
thing
super
was
excited.
great. It's really hard. It's like going to the gym. It's not like, it's hard at first, but then you love it afterwards.